Great. Well, glad you're joining us. Welcome to our fourth session of the I Thought I Was Covered for That Insurance webinar series. I'm Elizabeth Higgins with the Eastern New York team, and today with us we have Lucas Smith with Ag Workforce Development and Maria Ullrich with she's with the Eastern New York team and also CCE Orange County. And they will be covering topics of insuring the people that you work with. So, in health insurance, disability insurance, life insurance. If you have questions, feel free to put them in the chat and we'll stop periodically and answer them. I will be sending out recordings of last week and this week's session later this week. So you've gotten the first two sessions, you'll get these two sessions, and then we have one more session next week on property insurance. And then at the very end, I will send out all of the links to all of the webinars so that you'll have them in one location. So hopefully this has been really helpful. And with that, I'm going to turn it over to Lucas Smith to get us started.
All right, now that we've tested the tech, it probably isn't going to work now, right? I won't find my PowerPoint. Let's see here. How would I do?
You're not on the, there you go. Now you're perfect.
You can see it?
Yep, I can see it.
Okay, fantastic. Well, hi everyone. Yeah, so the first part of the presentation today for insuring people, we're going to talk about health and disability insurance. We're going to touch on workers' comp a little bit at the end. It's different than disability insurance, but just as important for you to know about. So we'll talk briefly about workers' comp as well. So just off the bat, a quick disclaimer. This is not legal advice. Anything I say here today, consult your attorney for specific legal questions. And we're also talking a lot about employee benefits, and you should work with your benefits advisor for questions in that area. So again, we're here to talk about health insurance and disability insurance, but right off the bat, I'm throwing some bonus coverage at you since this has been something new that is a new requirement for 2026 that employers have been worried about, and that's a retirement plan. So New York has this new program taking effect in 2026. So here over the next couple of months, requiring employers to facilitate some kind of retirement savings program. And this is the requirement. So if you check all three of these boxes, you want to listen more and watch for more details on this, but it's if you employ 10 or more employees, you've been in business for at least 2 years, and if you don't already offer a qualified retirement plan. So again, if all three of those boxes apply to you and you haven't heard about this program or already signed up, Ag Workforce Development has an office hours February 12th, which I think is next week, that you're going to want to tune into, where we're going to talk in depth about this program and its requirements. So I wanted to flag that, some bonus coverage right off the top of the hour. All right, getting to the meat and potatoes of today. Yeah, we're going to talk about health insurance first, and it is a beast to talk about health insurance. So here I've got a little bit of a pyramid for you, and this is really showing the complexity of health insurance on a scale. So we're going to start with the most complex at the top and kind of work our way down. So we're going to start with group health insurance, work our way towards stipends, and talk a little bit about everything in between. And there's reasons, of course, that you'd want to start higher up the pyramid. So although I'm using this to demonstrate, again, the complexity, you don't have to start at the bottom and work your way up. There's a lot of reasons an employer would choose to start with an HSA or start with a group health insurance plan. But generally, from a cost perspective, the higher up the pyramid you go, the more costly from both providing the benefit and the administration side in the paperwork demand. So keep that in mind as we get started. All right, of course, with anything with a large topic, there's lots of also exceptions and exemptions and things like that. So first, I do want to mention for large employers, which is anyone with 50 or more full-time equivalents, the Affordable Care Act has some requirements for what health insurance you have to offer to your full-time employees. For purposes of being a large employer, what they call an ALE under the Affordable Care Act, that's full-time is someone expected to work 30 or 30 plus hours per week or 130 hours per month. And part-time hours in that calculation are divided by 30 to create that full-time equivalent. You've probably done this for purposes of other programs, qualifying for other programs, but that's the math for Affordable Care Act purposes, figuring out if you're have 50 or more employees. And if you have 50 or more employees, a lot of this information is still going to be valuable, but it's a lot less optional. If you have less than 50 employees, you've got a little more leeway with what you can do. Also, with this, want to mention for seasonal employees that they are not counted towards the full-time equivalents if they work less than 120 days per year, which depending on how much you utilize seasonal employees and what type of seasonal employee you utilize, you may or may not have them working less than 120 days a year. You might have 100 employees, 100 seasonal employees working 100 days a year, and they wouldn't count towards that 50 employee FTE cap for Affordable Care Act purposes. So keep that in mind. And there's a bunch of other nuance too with this. So if you're very close to that 50 employee threshold, you're going to want to work with a benefits advisor to make sure you're in compliance with the Affordable Care Act. All right, as well, in the title of this presentation, we mentioned also insuring you as business owners. Assumedly, a lot of you are business owners or partners in a business, and that complicates things a little bit. As most of you already probably know, when you're a partner in an LLC or a business owner, you're often not eligible to participate in some of the same health plans that you can when you are an employee. So in that case, you can still seek coverage on the exchange individually outside of the business or from a private off-exchange insurer. But if the business pays those premiums on your behalf, it's still considered income in many cases, but there's a deduction that usually will apply to help mitigate some of that tax impact. So we'll talk a little more about owners and partners and the nuance there with some of the other pieces. But this is the gist of it is if you own the business, there's an asterisk next to your ability to participate in a lot of these programs. All right, as well, want to touch on the essential program. I promise we're getting to the pyramid here very quickly, but the essential program is another really important program for many agricultural employees. It's offered for the New York State of Health. We're going to talk a little bit more about that with the group health insurance plans, but that's the official health plan marketplace in New York State. And the essential plan is free health insurance from the state of New York available to employees who meet these requirements. They're New York residents, they're lawfully present in the U.S. between the ages of 19 and 64, and they're not eligible for Medicaid or employer coverage. So there's a lot of agricultural employees that might not satisfy these requirements. There's a lot that will. In particular, H2A, the essential plan tends to be a popular option for them if they meet the requirements. And you might not know if your employees are enrolled in the essential plan. And why that's important for you to know that you might not know is if you start offering a group health insurance plan thinking your employees don't have coverage, when the vast majority of your employees are on the essential plan, they're going to lose eligibility. So that's just something you want to keep in mind is that if your workforce is taking advantage of the essential plan, which costs them nothing to participate in, and it costs you nothing, which is really hard to beat, you might want to think a little bit different about how you structure your health benefits. With that as well, mentioning what the income restrictions are, the one person maximum income to participate through July 2026 is $39,000. Yeah, that's why it tends to be popular with H2A. Is in most cases they're well under the income cap. That likely is going to go down starting in July. It might be pushing closer to 30,000 to be determined. But as we start to see things change with the essential plan, there might be more interest from employees in participating in other forms of health insurance that you might be able to offer. All right, group health insurance. This is the behemoth here. So options for most small employers are available through the New York State of Health, the portal I already mentioned. And so who qualifies to be able to go for insurance through the New York State of Health? That's anyone with 1 to 100 FTEs. That FTE calculation is using the same calculation that we talked about earlier. So the seasonal employees and things like that, it all layers in to get to the FTEs based on that earlier information I provided. One of the unique things, if you choose to offer insurance through the New York State of Health, is you have to offer the coverage to all full-time employees. Now, that doesn't mean that all full-time employees have to have the health coverage. That just means you have to offer it to them, and then it's their choice whether to participate. Another benefit of procuring group health insurance through the New York State of Health is potential for the small business healthcare tax credit. And I'm going to talk briefly about that on the next slide, the details of it, because it's very different than the 1 to 100 wide range that we have for this uh, for generally participating in the portal. And then also for group health insurance, you can look at private health plans, and that can be direct from a private carrier or through a broker. And so if you're a large employer with 101 plus FTEs, where the New York State of Health isn't an option for you, then private health plans tend to be where you have to turn to. And there's lots of options out there. You probably received the promotional materials in the mail if you're a large employer, because it tends to get very salesy when you're at that level. Okay, so briefly here on the small business healthcare tax credit, the eligibility for it, again, it's not to participate in the New York State of Health portal, it's 1 to 100 FTEs. For the tax credit, it's fewer than 25 FTEs, so much, much smaller employers than who can generally participate in buying insurance through the portal are eligible for the tax credit. And they also you also have to have average annual wages below 65,000, and you have to pay at least 50% of the employee only coverage. So that's covering an individual, not the family plan. And then it also has to be offered to all full-time employees, which again is a requirement to procure insurance through the New York State of Health to begin with. So that's the gist of the small business healthcare tax credit. So if you're in that fewer than 25 FTE category and thinking about group health insurance, you definitely want to keep this in mind because that credit's worth up to 50% of the employer paid premium costs for up to 2 consecutive years. So it can be incredibly valuable as you're phasing in a new group health insurance plan. Now, this tax credit does have an expiration date, so it's not something that necessarily is going to be available forever, but it is available now. And the other interesting thing with this is that if you're not seeking the tax credit, I'll mention, if you're not seeking the tax credit and you're below the 50 employee ACA threshold, you do have a lot more discretion with how much you can, how much of the premium portion you can shoulder on behalf of your employees. So you see with the business with the health care tax credit, you have to pay at least 50%. If you're not trying to get the tax credit and you're not the 50 plus employee ALE, you have a lot more discretion on what portion you as an employer choose to pick up. All right, so here's the slide that if you know anything about health insurance, you might have been dreading seeing or that you're always confused about. These are all the terms all in one spot. So we got HMO, PPO, EPO, and then HDHP. If you know anything about health insurance, you've seen these terms, you've heard those acronyms before. This is them all in one place. And most of these plans, these are all different types of plans. Most of them are available through the New York State of Health. Not all of them are, and it varies by county, by region. Same thing with what the costs are for the plans. But generally, the employer share of any of these plans is going to be in the range of $400 to $800 per month per employee. Again, that's very vague numbers, and it varies dramatically by region. The closer you are to the city, the higher the premiums tend to be. Tompkins County, where I'm at on campus, actually has an almost $900 sometimes employer share for some of the programs, so it's more expensive. But these are the basic areas that you can look for coverage for your employees. So the HMO, the major features of that are predictable costs and lower premiums. And that's what makes it attractive. Some of the drawbacks to that, though, is if there isn't a strong local provider network. So for me, when I think of a strong local provider network, I'm from the Finger Lakes. I think the Rochester region has U of R and RGH, lots of marquee providers like that. This plan the HMO can be a really good option. If you don't have that, you're in the middle of nowhere, rural New York, HMOs are not a very good option because they really don't have any out-of-network coverage, except for in the case of an emergency, and they require referrals from a primary care physician. So PPOs have a much larger provider access networks, so they tend to be a little more popular with more isolated communities, and they're also a lot more flexible. They do come with higher deductibles, so that can hurt your employees' ability to truly benefit from the plan. And they often have higher premiums as well, but they can be a strong choice again for more isolated agricultural workforces. All right, and then EPO, the exclusive provider organization, that's a compromise between the HMO and PPO in terms of cost and flexibility. Oh, I skipped past. That is lower premiums, no out of network coverage. Again, you're seeing two of those elements come together, and you have to have a primary care physician to coordinate referrals. So again, for an agricultural workforce, the EPO isn't always the best option because it does have some limitations that aren't the best in a rural area.
So before you move on, Lucas, we had one
Yep.
question about the essential plan,
Yeah.
whether or not it
Sorry.
was available to all New York residents that meet the requirements, or specifically like through an employer, as you were talking about.
Sure, the essential plan. I'll skip back to it. It is actually not through the employer at all. So I mentioned if your employees are taking advantage of it, you might not know they are, is because the employer is not involved at all. The employee directly applies and directly manages that insurance. So that's why I flag this, is because there certainly are many cases where you might not know that your employees are taking advantage of the essential plan unless you
Yeah.
ask them.
Yeah, I would actually add my son is using the essential plan at the moment, and it's worked out really well for him. So it would be something that maybe to like even guide your employees too as a potential option for them.
Absolutely. And absolutely. Why I mentioned it as well is that there's a lot of changes happening with the essential plan. So eligibility is changing in that area. So you'll want to track that because your employees may lose eligibility for the essential plan. And then
Mhm.
they may be asking you for options. Yeah, thanks for flagging that, Liz. Sorry, I
And
was
then there was
rolling
one
there.
other question, going back to the Affordable Care Act, about whether or not seasonal employees are full-time employees as far as hours, but if they work less than 120 a year, are they like, is it just somebody who works less than 120 hours a year, or is there some type of definition that defines them as a seasonal employee?
Yeah, there's quite a bit of nuance to the seasonal part. I'll go back to that also briefly. Yeah, so they're not counted towards the full-time equivalents if they work 120 days or a year or less. Uh, that's the gist of it. If you've got an employee that in the year works 110 days, they're not considered an FTE for purposes of whether you're required to offer health insurance.
Actually, one nuance I would add to that is it has to be a class of employees that are typically hired as a group around the same time each year. So, like seasonal farm workers, they're always in the summer, summer lifeguards, the people that you hire for the Christmas rush. But an employee who you hire and then as a normal full time job and then they quit before 120 hours would not exempt you
That
if it was
that was
otherwise a full time year round job.
so that's exactly the nuance which I skipped over actually. So that the 120 days is separate from that requirement. So the 120 days is that's one definition, seasonal employee. Seasonal worker, what you're referring to, Liz, is the calculation of when they're considered a full-time employee that you have to offer coverage to. All the 120-day rule does is determine if someone is an FTE for purposes of whether you meet 50 or more. The 6 months and employed around the same time every year, that determines whether an individual employee is a seasonal employee that you're required to offer coverage to. Someone that works for you for 5 months of the year full time, around the same time every year, even though they're full time for those 5 months, you may not have to offer them coverage, even though they're technically a full-time employee because they're a seasonal employee. So that's the nuance. There's actually two separate definitions of
Mhm.
seasonal employee. I tried to glaze over that, but I'm glad someone caught it. And thanks for flagging that. Again, it's very, very subtle and it applies to two separate parts of the Affordable Care Act.
Great. Thank you very much. Okay.
Yes. Yeah, keep flagging questions for me too, and I'll and I know this is the most boring part of the health insurance too, is this slide. So the last one we were on was the HDHP. That's got the lowest premiums, the highest deductible. It tends to be the cheapest plan for an employer trying to get into offering the group health insurance. So that's the most affordable option. But again, with that high deductible, how valuable it is to your employees may be more limited. And then the tiers you'll see on the left side, if you're going through the New York State of Health, there's actually tiers that you can choose between. All those metal tiers, bronze, silver, gold, platinum change is what percentage of medical care the plan will cover. So you can have a bronze HMO or a gold HMO, or then a silver PPO, any combination. So the tiers change what percentage of medical care is covered. And then you have these HMO, PPO, EPO, HDHP, and a couple other smaller ones that change what the benefits look like within that. Last thing I want to note as well with group health insurance before we move on down the pyramid is that dental and vision benefits often come up. Group health insurance options through the New York State of Health typically don't include vision and dental benefits, or if anything, they include very limited vision coverage, very, very limited. So if your workforce is interested in or in having vision and dental coverage, they can either go out and get that coverage separately from your group health insurance plan you offer, or if you're interested in offering dental and vision benefits, you can also either get that as an add-on, usually to your policy through the New York State of Health, or you can oftentimes find cheaper coverage independently for just dental through some other provider. So that's the last thing I want to flag with that. All right, health savings accounts. So we're moving down the pyramid here. Health savings accounts, I consider a little less complex, but they're only less complex to an extent because there's a little less requirements for tracking and things like that. But it's an employee-owned savings account that you can only offer to if you already offer a high deductible health plan. So it's only a little less complex, but if you don't offer a high deductible health plan, the health savings account isn't necessarily an option you're going to be able to explore. But it can be incredibly valuable because it's an employee-owned savings account. And then employers have the option to choose how much they want to contribute. So you can do anything like a match or a yearly contribution, monthly contribution to this health savings account. And then there's some significant tax benefits for the employer. That employer contributions are not subject to payroll taxes, and they're a deductible business expense. So it's kind of like a double whammy of powerful benefits there for you as well as your employees, because it's not subject to payroll taxes. They're seeing more of what you're contributing. And it's essentially also functioning as a retirement account if they don't use the money. Because once they reach after age 65, they actually have access to use the funds in their HSA for non-medical expenses, although subject to regular income taxes, but not subject to penalties, very similar to a traditional IRA setup. So again, that money is invested and grows tax-free. Employers that offer HDHP plans, high deductible health plans, HSAs tend to be, again, very popular because it's a lower cost, lower administration add-on that is a significant retirement option for employees. All right, flexible spending account. That's another similar thing to HSA where it's only an option if the employer already offers some other type of group health plan. And the interesting thing with FSAs is eligibility can limited to certain classes of employees. And what I mean by classes of employees is, seasonal versus full-time year-round. There's certainly typical anti-discrimination requirements prohibit any kind of classifications based on race or any other protected characteristics. So unlike an HSA, this money in an FSA isn't invested, but the employee, interesting with this, actually chooses how much they want to contribute up to the annual limit set by the IRS every year. And that contribution you take as an employer is divided evenly across every paycheck. And then it goes into this flexible spending account. And that's taken out pre-tax again. So that creates that benefit to both the employee and the employer. And then you as an employer can elect to contribute and again, match or do a one-time contribution every year, or any combination of things that you'd like. And it does not affect the employee's IRS annual limit that they can contribute. So this has the potential to be a really great add-on option if you offer a group health plan and you want to, again, provide a little more flexibility for your employees. The only thing that tends to get missed by employees that start taking advantage of these plans is the money at the end of the plan year is generally lost, and the employee can't take it with them. So it's use it or lose it. So the plan year could, doesn't have to be the calendar year, but if your plan year starts December 1st, you don't use all the money by November, the end of November, and I've got $200 still in there, it just disappears and it starts over. So that can be a little confusing for employees that don't understand that with this plan. And employers can also build in some flexibility of a short rollover period, but that's just the mechanics of the FSA and the tax benefits that it allows is that it's use it or lose it. And it's not portable when the employee leaves your employment since it's tied to your group health plan. All right. Any other questions I should be flagging, Liz? It's hard for me to see them. If not, we will talk about some other interesting things here is health reimbursement accounts. So I always call it QSHERA and ICHRA, but those are terrible butcherings of the pronunciation. So, but that's just what comes to mind for me. Both of those things, I don't know. That's just how I read them. But they're health reimbursement accounts. These are other really good options for employers that are not directly health insurance. It doesn't satisfy the requirement that for you to offer health insurance under the ACA if you're a large employer. So the HRA is really just either an add-on, again, another add-on option if you already offer some kind of health insurance, or if you don't quite think offering health insurance is something you can afford or are ready to offer, the HRA can be a great middle step and also offers a lot of flexibility for our ag workforces. So the big things that these two plans have in common is they're tax-free reimbursements to employees for qualified health premiums and out-of-pocket medical expenses. And so that makes it a tax-deductible expense for the employer. Similar to the other things we've talked about, the tax-deductible expense for employer. But again, that's the benefit for you as an employer of offering these. There isn't tax credits or things like that, but it is tax-deductible as a business expense. So employees with these plans, with a health reimbursement account rather, they secure their own health insurance, and then that makes them eligible for these tax advantage reimbursements for the premiums or out-of-pocket expenses. So the employee has to submit proof. That tends to be one of the hiccups with these plans. If an employer offers it, is the employee has to submit proof to qualify for the plan under IRS rules. So what that looks like if you're reimbursing for premium. So I've got an employee that's got insurance elsewhere, but I want to reimburse part of their premiums. They need to submit proof of minimum coverage under the ACA to you, and then as well submit some kind of proof that they're making the payment. So for the premium. So that could be one bill that shows that that's the same premium amount every month, or it could be every month they submit the premium bill to you. So it can be quite burdensome for an employer to manage the reimbursement side of things, or the documentation side of things for reimbursements. But at the simplest level, you can require twice a year. They give you proof of minimum coverage, and then proof that they're going to make the payments on the premiums. And the other thing with this, I mentioned early on, owners and partners. Partners in a business can't participate in these. Oftentimes, that people think they can if they're part of an LLC or a partner in a business. They can't participate unless you're a dependent on a W-2 spouse. So that's a common workaround that farm owners will go through if they have a spouse that's employed as a bookkeeper and they're a W-2 employee. That can kind of give you a back access route to be able to participate yourself in one of these programs. So there is a few differences between these programs. I'm going to run through them kind of quick here. So QSERA, again, pardon the pronunciation, that's available to employers with less than 50 FTEs. And generally that QSERA is going to be the preferred program for smaller employers. It's just administratively a little easier. So if you're thinking about a health reimbursement account, QSERA, again, if you're a smaller employer, is generally considered the easier program. But an ICHRA is available to any size employer. So if you got 100+ employees, that's an option if this is something you want to offer. So you may not offer any group health plan as one of the other downsides to QSERA versus with ICHRA. You can offer a group health plan to some employees and then offer the ICHRA to others, which is kind of unique there. So you can, again, have those classes of employees of having a group health plan for some of your full-time employees, and then ICHRA might be for your seasonal employees. USERA also has some set caps on how much you can reimburse every year versus under ICHRA. You get to set your own cap. So you could have it be $1 million a year. You could have it be, $100 a year or anywhere in between or less than that or more than that. So you have a lot more flexibility with how much of a benefit you're giving to your employees with that plan. And the other thing is that terms have to be the same for all full-time employees. You kind of heard that already with the offering a group health plan versus offering an ICHRA. It's in terms of reimbursement terms, you can offer different reimbursement terms with an ICHRA. You can't do that with a QSERA. So that can, again, be very valuable for an employer that wants to tailor the terms more specifically of how much reimbursement is available for their employees that are only going to be there for 100 days a year. Giving them the same potential benefit as their full-time employees might not make sense. And so you have the option to play with those terms a little more with an ICHRA. All right. That's the end of that part. Few other things I want to mention that these are not directly insurance, but there's things that we're hearing more and more about as employers having these come up. Excuse me. So a direct primary care. This is essentially a flat membership fee that's paid to a care provider, and they provide this essentially unlimited subscription care to someone, could be your workers, for preventative care and basic illness. So it's not, directly with a hospital. It tends to be just a solo practitioner on their own that has, again, this membership fee, and it's, could be, $100 a month or something like that, or it could be $100 a year, and it's unlimited access. Again, we're hearing this as something that's coming up as an option that providers are starting to offer, especially for the agricultural workforce. The things to note with this is that if you as an employer pay for it, it's treated as a taxable benefit to their employee. So there's no special tax breaks or tax deductions for you, or for you, it's a business expense, but for the employee, they're getting taxed on it on their W-2 and on their pay stubs. So the value might be a little bit less to them. Because of that, it's reducing, their income. But you are providing them that unlimited access to care. So it's great for routine care, workforces with frequent urgent care visits. But again, it doesn't provide coverage for hospital visits, surgery, or specialty care. And that's what often gets missed with DPC when that comes up as an option an employer wants to offer, employees are interested in, is that it is not a substitute for insurance. It can be great if there's also some level of minimum insurance also available, or employees already have the essential plan. This can be a great supplement, but it does not supplement for full insurance. The other thing is that for employers is that there's ERISA complications that can come up with this. So you need to be aware that you're going to be responsible for creating plan documents, and there's templates available to do that. So I make it sound worse than it is, but there is some administrative requirements you'll be responsible for if you enter into a DPC agreement. And again, this is a newer thing we're hearing more and more interest from, and being potentially more of an option in the future for farm employers in particular. All right, stipends. We're getting through this. Stipends, this is arguably the easiest option for an employer to offer a health stipend. What it is, it's a taxable cash payment to employees in lieu of providing any direct healthcare benefits. So it's subject to payroll taxes. It's still deductible to you as an employer as a business expense. But the value is obviously less to an employee. If you say you're going to give a $500 a year healthcare stipend, it's going to be worth less than that because they're going to be taxed on it. So that's a consideration both from you as an employer side and what you're hoping to achieve with offering a stipend with your workforce, and also with what communication you need to do with your workforce if you choose to offer a stipend, and helping them understand how valuable it is and what exactly the stipend is for. So the great thing is because there's no regulatory restrictions on what you can do other than that it's taxed as regular payroll taxes are, is that you can do any kind of frequency you want, you can do any amount you want. So you have a lot of discretion what you can do. Now, just as a general kind of benchmark note, the lowest cost plan, I mentioned this earlier, for an individual through the New York State of Health Exchange, if they're trying to get insurance on their own, the lowest cost plan tends to be in the $500 to $600 a month range. So if you're thinking about a stipend, that's something to keep in mind is that's kind of what employees are up against if they're going out to get insurance for themselves. They're in the $500 to $600 range if they're trying to get health insurance, if not more, for better coverage or depending on what region you are. And then it's also worth mentioning as well that we see this in more corporate environments, that wellness programs, broader wellness programs, but I think it's something that also farm employers can potentially consider, and it can pair especially well with a stipend concept, is doing things like subsidizing a gym membership at the local gym, or having a flu clinic on the farm every season, or even discounted counseling sessions. The number of things go on, but there's other like wellness program benefits that you can offer as an employer that are outside of traditional health insurance, that are can be incredibly valuable and really appreciated by your workforce. So the one thing that's a downside with stipends as well, and the last thing on this, and this is the last thing with health insurance, and we can take some questions and make sure we're wrapping that up, is that again, since it's a taxable cash payment, you can't ask employees what they're doing with their money. So you're just giving them money and saying, hey, this is in lieu of health insurance or for you to go secure healthcare benefits, but you can't ask them what they're actually doing with it, and you can't require proof of that. So your employees can go buy, drugs and cigarettes with it per se, or go buy a new car with it or anything like that. And it's not for you to ask. And so that can be a significant limitation of the stipend. And that's health
So,
insurance in a nutshell.
okay, so we have a couple of questions. One is, and I don't know if you're touching on disability coverage, or I'm
Yep.
sorry, workman's comp, but one person asked if there's any overlaps between health insurance and liability insurance. For example, if an employee suffers a serious injury that requires medical care covered by insurance, does liability insurance also cover any potential injury claims, or does the invocation of one negate the other?
Yeah, well, I think you mentioned it, Liz. Workers' comp certainly is a huge part of it for on the job injuries, but
Mhm.
liability insurance can also be a piece of it. But certainly you've done the liability insurance presentation. Am I missing things with that?
Yeah, I would say that they would be separate. You know, the workman's comp would cover what workman's comp covers and an on the job injury. And then if that person then sued you for the injury, that's when your liability insurance would be likely to cover you. And then the one question is somebody asked if you had specific recommendations for insurance for the farmer as opposed to a farmer insuring their employees.
Yeah, insurance for a farmer. So I mentioned this briefly early on. Farmers can go through the New York State of Health themselves as an individual and procure insurance. That is certainly an option. And again, the premium expenses are deductible as a business expense, so that can be a great way to do it. One thing I didn't mention that if you start digging into this area will come up is there are some other things I didn't mention, like healthcare sharing ministries. Sometimes farm owners will look into that. It is not health insurance, but it helps cover health expenses, and it's not regulated. That's a term to be aware of and an option that might be worth looking into. Again, if cost on the marketplace just seems prohibitive. But those are the two things that come to mind. It is admittedly trickier, just because you're not a W-2 employee, so it's more of a challenge.
I will say that at least in New York, I've seen, and maybe this is what you're talking about, sort of doctors providing cooperative health care too. So there are some doctors that you can like have a membership or pay a certain amount a month, and they will cover whatever they can possibly do in their office. I mean, obviously, if it's something that requires a hospital, they tap out, but all the things that they can possibly do, they cover. I've seen a rise in that sort of in those business models lately too.
Yeah, that's the DPC. I think I got that acronym right. Yeah, just before stipends I was talking about. Exactly. You're right. You're right, Mayor. And that you're right. That can be a great option for farm owners directly themselves too.
Yeah, the other thing I would look at would be to see if sometimes grower or membership associations provide one of the benefits of joining an organization is sometimes access to subsidized or discounted or group plans, through that. And that could be just something to look at to see if there's any, as a business owner, any, organizations that you would otherwise consider joining that may also have some group benefits, whether it's life insurance, health insurance, or other types of insurance.
Yeah, absolutely. It can be challenging when you're again, you're not that W-2 employee and things get challenging. We're going to hear more about that with disability insurance and workers' comp as well. But anything else on health insurance?
Um, we have are you going to cover specifically workman's comp? I have a workman's comp
Yeah.
question.
Yeah, let's and for the sake of time too, we can also
Okay, let's
keep
save that then for workman's comp. Um, and yeah, why don't a couple of these are more just sort of general, and so let's move on, and then we can answer some of the
yep.
more general ones later on.
All right, disability insurance, workers' comp, and we're going to rattle through some of this. Um, Disability benefits and workers' comp. Pretty much here's the rule. If you have employees, you're legally required to have both coverages. The wording in the regulations is one employee for 30 days in a calendar year. Not all the regulations say that, but most of them. So if you have employees, you pretty much are required to have both the DBL and WC coverage in New York State. The things to note with that are, though, is that a spouse, minor children, they're not counted as employees, so they're not covered unless they're W-2 employees. Um, and then sole proprietor that we're talking about, if that exception category that makes it hard for business owners to get health insurance, that also applies to disability insurance and workers' comp, except for it's much easier for you to opt in. If you're an owner of a business, it's generally just you say, hey, I want to also be covered on the policy. And usually that's exactly how it goes for disability insurance and workers' comp. So it is much easier than with health insurance where you're just barred. It's not an option. Um, but you're not required to have coverage like you are for your employees in New York State as an owner of the business, and you're not automatically eligible either, included when you get a policy. All right, workers' comp. Hopefully, everyone knows what workers' comp's for. It's for work-related injuries and illness, and where workers' comp policies can be obtained. That's through private carriers, organizations. We talked about how valuable organizations can be already. Farm Bureau offers workers' comp coverage for members. That's actually through the New York State Insurance Fund, but you can also go through the New York State Insurance Fund directly, and that tends to be what many employers like to do because it's tends to be the simplest process. They're actually fairly good at it and have a fairly user-friendly portal for managing all things related to claims and policy management. So if you're looking for different coverage, the New York State Insurance Fund can be a good place either to start um, or to look for more resources. Okay, a couple documentation tips related to workers' comp. Again, it's required you have it. We mentioned a couple of the places you can turn. Documentation really is everything with workers' comp cases. So you need to complete immediately any kind of injury or accident report, whatever your process is. And if you don't have a process, your insurer usually will have SOPs or forms that you can get from them to create a process so you can document any kind of minor injury right away. And that's really because a minor injury can turn into a claim down the line. A nick on the finger or something like that could turn into, a hospital visit. So if you don't document it from the start, that tends to be where workers' comp issues arise and employers get in trouble as they say, whoa, wait a second, there was no claim. But if there was no documentation from the start, it can be a lot harder to defend against. As well, you need to report those incidents to your insurer in a timely manner. So separate from your internal injury and accident reports, your insurers require that you let them know employee was injured or had a work-related illness. as quickly as you can. Generally, it's around the time frame of 10 days from when you learn about uh, the uh, illness or injury, assuming the illness or injury resulted in certain amounts of lost time or things like that. But it's as quick as you can. You should go into the portal and let your insurer know.
So one question we had related to that is, let's say somebody gets hurt and they fill in a thing at work, like they cut their hand or whatever, but they don't go to the doctor, they don't need any time off. Would you report that to your insurance company, or would you only report injuries that actually result in time off and or a doctor's visit?
Yeah, that's a great question. And, certainly that's the type of question your insurer would love to hear from you and answer. But most insurers have what's called like a first aid exception. I forget exactly what it's called. It's called like a first aid exception, something like that. That's relatively minor. You don't always have to report. And even things that that might end up requiring like very minimal medical attention, you don't necessarily have to report. So that you can avoid potentially that impact on your workers' comp premium, from having more claims. You have to look with your insurer and see what their specific rules are. But the New York State Insurance Fund has that first aid exception that allows you to not report and actually just kind of pay some stuff directly yourself without workers' comp becoming involved. But it's very specific to the insurer.
But you'd
They
want to
would
make
rather
sure you have
you
that internal documentation process so they don't think that you're not like actually documenting things.
Absolutely, absolutely. The internal process is critical, regardless, and generally as well for small claims. Some insurers have procedures for that. Essentially, if it turns out like, geez, this didn't make sense to report. They have ways of almost forgiving that filing if it turned out it wasn't necessary, so it doesn't have an impact on your report long term. Again, that varies by the insurer.
Uh, the only thing I want to pop out here is like if an employee gets hurt, strong, ER or urgent care, someplace that's most likely going to take workman's comp. Their regular doctor might not, and then it can become this huge like runaround about finding a doctor that does take workman's comp. If you farm near the border of New York State, make sure the doctor's in New York and not Pennsylvania or Vermont or whatever, because that's another issue. So the initial things that happen when somebody gets hurt at work are huge, including the documentation, but making sure they go to the right place right off the bat is huge, and making sure it's not a headache for you or them later.
Absolutely. All right, quickly here on document retention related to this as well. New York State requires you keep documents related to work-related injury and illness for 18 years. That's a long time, but if you're not in the habit of that's the requirement. But you can as well purge files that are outside of that retention period, and it's often good practice to do so, so you don't have 100 years of injury related records that you're not required to have. So 18 years for New York State. OSHA is 5 years, and there's the OSHA 300 log and a couple other things, and the OSHA summary report you have to post. We could do a whole presentation on OSHA, so that's the extent of what I'll say on OSHA is they have a 5-year retention policy, 18 years for New York State. So hold on to the records for the appropriate amount of time and follow OSHA's requirements if you're subject to OSHA's 300 log reporting requirements. There are some exemptions for that some agricultural employers may qualify for. But be aware of how long you're supposed to keep a hold of documents. And the last thing is for independent contractors, I think people often forget you have independent contractors working on your farm. They're building a barn for you or something, or the electrician's there. You should request a certificate of workers' comp insurance from them and add it to your records. Because if that independent contractor gets hurt while they're working at your site, they're probably going to come after you too. And having that certificate of workers' compensation insurance can be very helpful in defending against that case, because in some cases they'll go after whoever has the deepest pockets, and if you as the owner of the business have a deeper pocket than the business employing the independent contractor, they're gonna try to come after you as well. All right, disability insurance, and we're winding down here on all this. Um, Short-term disability also required in New York State. The thing that's often missed with this is that it provides an income supplement for off-the-job related injuries or illness. The medical care piece of things is completely the employee's responsibility. So the purpose of SDI and what it's for is, again, that income supplement for employees for off-the-job related injuries and illness. It has nothing to do with the medical piece of things. That's their responsibility, and their health insurance might become involved. But again, important for you to keep that in mind, because I think employers often forget and think, oh, SDI is they got hurt and that'll cover it even though they don't have health insurance. No, SDI is just that income supplement, and again, it's required. Related to that is paid family leave coverage, also required in New York State. Most DBL policies, disability policies that include SDI, will include paid family leave as a rider. If you're going through a New York State compliant insurance provider, your chances are you're already going to have PFL as a rider, and you'll have signed the forms and things like that. PFL is for covering family-related time off outside of the employee's own medical needs. So things like bonding with a new child or caring for a family member with a serious condition. That's what that's for. It's up to 12 weeks every 12 months. Excuse me. Related to that, to both SDI and PFEL, you as an employer can deduct a small piece from employees to secure coverage. You can see there at the bottom what that looks like. It's 60 cents a week for SDI and 0.432% up to that $400 a year for PFL. Some employers choose not to deduct for SDI or PFEL at all from employees. Again, that's a choice. You're allowed to up to those statutory maximums, but you're not required to. And some employers feel that that the minimal, for SDI, it's $30 a year you can get, that it's not worth the compliance headache of tracking that. So they're willing to absorb the cost rather than pass any on to employees. But that's completely your choice. Also want to mention quickly here that oftentimes we have part-time and seasonal employees that can qualify for a paid family leave waiver. Here's what the waiver eligibility requirements look like. Excuse me. It's if they work less than 20 hours per week and not more than 175 days a year. That one sometimes will apply for agricultural employers. What I think more often than not will trigger some waiver eligibility is the second two, which is they work more than 20 hours a week. Say they're working full time during harvest, but they won't be employed for 26 consecutive weeks. Again, H2A is another one that comes to mind for this. They often will be eligible for a waiver, and you're responsible as an employer to provide them with the waiver. It is their choice whether they sign it and opt out. And if they opt out, they will not be eligible for PFEL, but they also won't have it deducted from their paychecks. All right, last slide here quickly. We talked already about where you can get things with workers' comp. It's very similar for disability insurance, private carriers, organizations, and also the New York State Insurance Fund. They're a really great resource. And the other big thing is to make sure that you're posting the required notices of compliance from your insurance carrier. There's generally a bunch of forms that they fill out and they send to you. Put them up. It's the easiest way to avoid getting fined is if you put up the notices they give you. They're different and they're not in the packet that you print off from DOL. If that's how you do your New York State DOL compliance, you print off the packet every year. These forms are not in there. So it's a separate thing. Ask your insurance carrier. And then knew would be running short on time. Just mentioning a couple things with enhanced benefits you can offer your employees. There's enhanced disability coverage that you can offer. It's usually just an additional small fee you pay. And then you can offer a couple different things to your employees with disability insurance, such as a better benefit or longer duration. Or you can also look into long-term disability coverage, which can be a really attractive benefit for attracting employees, particularly for long-term. Yeah, and with that, I think I'm just about a minute or two over my time, but that's what I had for that presentation.
Yeah, there's just a couple of questions about whether you have any recommended templates for injury documentation or whether there's any sort of guidelines for employers around, especially workman's comp, that you would recommend as far as sort of roles and responsibilities.
Yeah, well, in terms of templates, every insurance provider out there, wherever your carrier is, they have templates. It's not something our program has at this point. There's plenty if you Google it, but absolutely your insurance carrier has them. Ask them. They're gonna give you lots and lots of things, and because they want you to do things right too. It's in their best interest. So your carrier will have no shortage of resources and also give you all sorts of best practices and things like that. So that's where I would say you turn for more information specifically.
So great.
I'm up. Okay, I'm going to share my screen. Mm, Okay. Oops. That. Where'd it go? There we go. Can we see it?
Yes.
Okay. So I'm gonna do a quick life insurance bit. So it's very important, life insurance, lots of questions about it. And it is the fact of life. Everybody dies. And so talking about life insurance or addressing life insurance or using life insurance as an estate planning tool and or a farm income planning, farm income tool or family income tool is often difficult to discuss because it relies on somebody dying for you to get it. But it is the reality and it can be used as an excellent tool to help the farm continue. Also, it can be used as like I said, an estate planning tool where that the kid or kids that aren't getting the farm get the life insurance policy, things like that. It can be worked into the plan, but you have to be able to talk about it. Everybody has to be willing to step up and say they're going to die. So why does it matter? Again, income protection, debt coverage, farm continuity, all these things matter because depending on, who dies, even if it's not the farmer, it's the farmer's partner. So this is going to sound sexist, but it's probably, it's the truth. So it's not the husband that dies, it's the wife. But if there's three little kids, now he needs to spend money on childcare, other things so that he can continue to farm. So, or she had an off-farm job that helps support some of these things like health insurance. And so now we need the money to replace that because the farm can't do it. So even if it's not the farmer, it is important in farm continuity. And of course, farms have unique risks and there's uses for farmers, seasonal incomes. What happens if somebody dies in the middle of harvest and now you've missed out on, because nobody else or you couldn't cover getting everything in by the time by the time the season was over? Personal debt, that you had a lot of personal debt. You were expecting the farm to continue in such a way. Of course, we all know farms are land rich and cash poor, and you want to probably want to keep the land in the family. And then it can, again, part of estate planning, can be part of a buy sell plan. The life insurance can be used to buy out other partners or children or something, and it is a succession planning tool. So let's talk about the kinds of insurance. This is the biggest question. So term, whole life, universal, and not really a life insurance, but I am going to talk about VADD, voluntary accidental death and dismemberment insurance, just briefly. So term life, term is just that. It's for a particular term, a number of years. It tends to be lower cost. The premium is fixed. It doesn't change. It's not the same for every policy, obviously, but because if you have a 10-year term or a 30-year term, usually it's at whoever you're insuring, it's at a particular age, like they're at 60 or 70. A lot of them just end at 70. Good luck trying to find a term policy that takes people beyond 70 because then you're just too much of a risk. It's good for debt and income replacement. And when the term ends, you have the you have no money. It's done. It's gone. Whatever you paid in premium is gone. And there's no accrual value. And obviously the premiums increase with age. So if your term is 30 years, it's going to end at your 70, you're 40 now. That premium's going to be less than if you're 50 and the term is only for 20 years, because the older you get, the higher risk you are. That's just the way it works. So remember that there's no accrual. So you hit 70, or the insured hits 70, the policy's done with. Maybe you paid $1,000, $2,000 a year, 3,000, it's gone. Bye-bye. Because that's the risk you take. That's what the actuaries are figuring out. Now, whole life is the opposite. Whole life premiums tend to be more. It's for your life. There is no end date. It is until the end date is when you die or you stop paying your premium, because that can happen too. So it's really the much more typical thing when you think of life insurance. It's permanent coverage as long as the premium is paid, higher premiums for the same level of coverage, but you can continue on forever. And there's a cash value accumulation that occurs. So and it's not small. So depending on how many years you've had the policy, so maybe you had the policy, it's on a child since they were an infant, and now you've had the policy 30 years and you've been paying a little bit each month for, a policy that's worth $100,000. So let's take the numbers. These are real numbers. $100,000 policy that you started when a child was 4 or 5, and now they're almost 40. Still, the $100,000 policy is still in effect. You paid, I don't know, $20 a month ish for this policy, maybe 30. And now it's got an accrual value of $14,000. So you hand it over to the 40-year-old child and say, you're on your own now. You can either cash it in for the $14,000, or you pay the $30 a month premium and you have a life insurance policy. The plus is if you opened it when they were a child and now maybe that 40-year-old has a serious health concern, they couldn't get life insurance any other way. They still have it because the premium's been paid all along. It's still there. It is a set it and forget it. If you have an annual premium, you can just pay it once. You can pay it monthly. It's whatever you and your insurance agent decide. There is government oversight, but a lot of companies end up buying each other. So if you've had a policy for 20, 30, 40, 50 years, who you collect the money from may not be who you thought you were paying. So you can't really set it and forget it. You have to stay on top of what company bought another one, bought another one, bought another one over the years, just to make sure that everybody's still in business and that your premium is going where you think it is. And may not be accessible after a certain age, like term. You can't get a whole life policy after, definitely, probably after 70 for real, but maybe after 50 or 60, depending on health questions that they ask, and maybe even younger if you really do have a serious thing. So let's say that child, unfortunately, had been diagnosed with brain cancer and they had treatment and everything's great, they're in remission, but that's a question. Maybe that happened in their 20s and now they're 40. Nobody's going to give them health insurance. Well, we'll get to who might, but chances are nobody's going to give them health insurance. So now they have this $100,000 policy if they maintain it because you got it before, when they were little, before they were diagnosed. So this other kind, universal variable adjustable life insurance, this one is really wacky. It's a type of whole life. It's not straight though. So you don't just pay a premium. Often the premium uses that interest, or that the cash value that we would get back in a whole life, uses those dollars to fund the premium payments. So it like uses interest to fund the premium payments. Sometimes, in the very beginning of the policy, not at all. At the very end of the policy, more. But it can change your death benefit, that if you didn't earn as much interest and your premium went down, it could change the death benefit. And so it's kind of like a whole life policy and a stock brokerage account had a baby. So it's a lot more not risky, but just like it is, variable. So you really have to keep your eye on it. It is not set it and forget it and just pay your premium once a year. You need to pay attention to it much more seriously. However, because the interest pays the premium, you don't have a cash value, but you might have a much lower premium that you might be able to afford for a higher coverage level. But again, the coverage level can vary if that premium hasn't been covering itself with the interest. So, tax considerations. Death benefits are usually tax-free. So, if your employer did not pay the premium. So some people at work, the employer pays the premium. I don't know which jobs these are, but they do exist. The employer pays the premium for you. I mean, like, I guess, Walmart takes out a life insurance policy, but that's to pay them for all their employees, but that's to pay them, not the employee's family. Other companies do take out policies as, it's what they do, for the money for the family. That's taxable because that's considered income, but that's pretty rare. So if you have a $500,000 policy, somebody dies, you get a check because they have to pay interest from the day the person dies until they write you the check. Let's say the interest is, and they all vary. You got to look at this when you pick out your policy. Could be 1%, could be 2%, could be 0.2%, could be 4%. So you get your check for $500,000, but then it's $500,600 because the interest was 600 in that time. That $600 is taxable. So you will get a tax statement for that piece at the end, but it's usually really tiny. I mean, unless the life insurance company's taken forever to pay you and they don't want to, they're usually pay pretty quickly. That won't be a big check, but the bulk of the life insurance is not taxable. And yeah. So choosing your coverage amount, it depends on your debt level, your family needs, your succession goals. You got to do the math. There's a lot of online calculators for this. If you have an accountant, you obviously loop them into this conversation because you want to make sure enough is enough. And then what do you want to do with it? Is it a $500,000 policy that's going to get rolled right into the business to pay off some debt? Is it going to be $500,000 that gets invested in something, the stock brokerage account that then you collect income off because you're hoping that, or just a bank account that you're pretty sure you're going to get 4% interest on, or CD or something, and that interest is what becomes your income, but you don't touch the principal. All of those things need to be calculated so that it fits your financial goals when this person dies. So I want to talk about beneficiaries. Your will says my estate to be divided equally among my children per stirpes, which means by the branch. So if I have $100,000 and I have two kids, each kid gets $50,000. If one of those children is dead and they had two kids, then one kid gets $50,000 and two grandkids get $25,000 each. So it breaks down on the family tree that way. This is not just wills. The reason I bring this up in this conversation is because other beneficiaries work like this too. So when you list the beneficiaries on a life insurance policy, you need to are they concurrent, meaning they happen at the same time? I'm going to give 50% to this one and 50% to that one. Are they consecutive, which is this one's going to get 100%, but if they're dead because they don't, they're older and they don't have kids, like may it be my spouse. If my spouse is supposed to get 100% of it, but if they're dead, then it gets split 50% between each kid. So all of those multiple percentage options are available that you give it to one or many people, or And then what happens if that one or many people aren't around to take it either? So you need to talk to your advisors. What are your next steps? Talk to your advisors, integrate with your farm plan, obviously, and then review annually. It is really, really important. I can't tell you how important. So I will tell you. So my husband passed away a little more than 6 months ago. So I mean, I knew some of this stuff, but I really got a crash course, which is why I'm teaching it now. And so I'm going to give you a real life example about life insurance. So my husband, Kevin, had a first wife, Connie. They had 3 children, Caitlin, Brianna, Liam. You can see the boxes there on the left. And Caitlin has 2 children, Brianna has 1 child. Those 3 children range in age, the first generation, Caitlin, Brianna, Liam, range in age from 30 to 40. And then Caitlin's kids and Brianna's kids are 9 or 10, between 6 and 10. So then Kevin marries me. We have 2 kids. So Kevin passes away. There are 3 life insurance policies for Caitlin, Brianna, and Liam that Kevin took out when they were little. That was part of the divorce agreement, that there would be a $100,000 policy on each one of the kids. Kevin would maintain it, and he's maintained it forever. I don't remember what the divorce decree said, but we kept paying it. It's $120 a month for the 3 of them, or something like that. He's the beneficiary. Now, what happens if he's dead? What happens if one of those kids dies? Guess what? If Caitlin dies, that money does not go to her children, Tristan and Julian. It should, but because Kevin has multiple offspring, see, we had Dermot and Honoria together, and I was his wife at the time of death, that $100,000 in New York, at least a third of it would become mine, and the other 2/3 would get split between the 4 living children. Now, that is not what he intended. So you need to make sure the beneficiaries are handled. They need to get changed. And I've been working with Caitlin, Brianna, and Liam for months now to try and get them to take over. It's a little complicated. Take over the policies so that they pay the policy on their own, because again, they will not benefit necessarily if in the way that they should, or their children will, actually, for the 2 of them that are worried, that have kids. It's going to be a nightmare. So we need to figure this out. And so you need to make sure your beneficiaries, every year you look at all your policies to the beneficiaries. And these days it's pretty easy online to catch up and change and check and whatever. Not super easy, because sometimes they have to verify your identification, because you don't want anybody just changing beneficiaries. But you want to do that. And so where to buy? Do the math when you're shopping. So find a calculator that works for you, and I don't mean a calculator like that goes in your pocket, one online that can help you do the math. And as you're talking to agents, you can put them all in there and see what it says. Talk to your current agents. Talk to agents who already sell you insurance. They probably have life insurance policies they'd like to sell you. They might not be the cheapest, so you keep shopping. You don't always go with them. But cheap isn't always good either. Again, cheap, sometimes that company got bought by another company, and now you don't even know who to call when your policy, you need to make a payment because it was 20 years, or not make a payment, but collect because somebody passed away, because that was 20 years ago when you took it out. Organizations you belong to. So whether it's church organizations, other social organizations, many of them offer insurance, but life insurance is one of them. So ask around there. And also your spouse's employer. Now, the negative to spouse's employer is that often, because they might not just cover the employee, their employee, your spouse. your spouse may be able to also add on you or the kids or whatever else. Um, the negative is that spouse is not at that job. Guess what happens? The insurance goes bye-bye. But it's probably very cheap while they're there and could be super, super helpful if something happens. The other things I just want to mention are like TOD and well, that doesn't matter here really for transfer on death, some other things with money that matter that aren't in a will. But we were just going to talk about life insurance here. So does anybody have any questions about life insurance? Stop sharing. Oh, thank you. Anybody? All right, we're good. Liz, you want to take it over? Does anybody have any questions for Lucas either?
I will say, I think I saw one that wasn't resolved in the chat. The question about, where the economically viable point is for group plans and health insurance. Well, of course, it depends a lot on your budget. If you have an unlimited budget, anything can seem unlimited viable. Of course, that's not how most folks, where most farms are. Yeah. So generally, though, it's just a couple of employees. I think in like the 5 employee range, it starts to become at least an option that works both for employers and employees. But that's just the off the cuff math there. I think there's a question for you. Yeah. For healthy folks, why not simply invest rather than pay for a plan?
So that is something you can do, for sure. But it's that that probably takes, like the Christmas Club policy or whatever. I mean, you can't New York not insure your cars. But there's plenty of things you cannot insure because this is insurance, but you don't because are you really going to have that uh fortitude, financial fortitude to put that money aside every month, every year, whatever, and actually put it in your kitty. And of course, you are rolling the dice, and there's no doubt insurance companies make money for sure. That's their job, and they've done the math. But uh, are you gonna put that money aside and really save it and invest and end up with more money than they would have given you? Especially if it's a whole life policy, that is a little harder to, the whole life's a little better of a deal, although more money. Um, are you going to be able to do it? If you can do it, maybe.
Yeah, I would say that's what term life insurance is for, right? Like, because
Yeah.
I'm in that camp. Term life insurance tends to allow you, especially if you're like covering a mortgage, you're worried about covering like a really big bill if you die and you're relatively young, term life insurance is cheap. For the amount that you would get, and then, once that big liability goes away, that, future college payment, that loan that you owe money on, and you don't have that risk anymore, then you go back to an investing. But the other benefit to life insurance, and I can sort of speak to that, is that, yeah, the beneficiaries don't pay tax on it. And so that is, it's a very, and it doesn't go through probate, because you have a beneficiary. So it's, it is a relatively, from
Yeah.
a, it can be, depending on your sort of, your, what do you call it, your plan, sort of, can be a way of transferring resources
Right.
to
As somebody
beneficiaries.
who's been through this and knew a little bit ahead of time, but again, learning a lot. You want as little to go through probate as possible. You
Yeah.
want beneficiaries listed. You want all of your accounts to have transfer on death. You want, anybody you trust to share, to be co-owners on accounts or whatever else. As little as possible to go through probate, preferably less than $50,000. Any more than
Yeah.
that, it starts being a serious headache.
Oh my God, and it's so expensive.
Yes.
We were the executors of a estate recently. We probably spent 15, $16,000 on like a $300,000 estate.
Yep.
Like it was crazy in legal
Yep.
fees for probate.
The only thing that should be in your will, seriously, is jewelry and other things that can't have a legal ownership with somebody else or a beneficiary in some way. And bank accounts don't have to be, I learned this, bank accounts do not have to be co-owned by somebody. And there's multiple layers of ownership, whether they can write checks or not write checks, or just you die and it becomes theirs. There is a beneficiary option. So they can have zero control, not be on the checks, not be able to walk into the bank and ask about your balance or any of that kind of stuff, which you would want as you get older with maybe a child or somebody else that you're going to give power of attorney to. You can just have a beneficiary and that you die and they get it. And that's it. They don't have to have any other control, which I didn't know about until very recently.
You're, somebody who you may not anymore want the money to go to. But I think you
Right.
touched on the estate plan for life insurance. I think one of the things when I deal with people that are talking about transfer of a business or whatever, they often have multiple children. And life insurance, I think, is often a really effective way to be able to provide, something maybe to that child that isn't going to get the farm,
Right.
or to provide a way of sort of paying that the non-farming, partial owners off, if it depending
Yep.
on who you make the beneficiary.
And maybe the farming kids pay the premium
Mm-hmm.
and then the non-farming I mean, it can be worked out, but again, everybody has to own up to that death is going to happen and that everybody has to be comfortable with that conversation. That is not common. And so in these conversations, I'm going to recommend if you don't know who FarmNet is, it's counseling, both financial or legal, and as well as personal counseling to help a family get through this stuff so that when you're doing an estate plan, they'll help you, talk about, gee, Dad, I'm going to buy life insurance on you. Sure. Sounds morbid, but I need to pay my sister off who lives in another state and is a nurse or whatever else. Because I'm pretty sure you think we should split the farm in half, or I get two-thirds, she gets a third because I've worked on it, whatever the family, you know, uh, mission is about who gets what. You want to give her $100,000. I'm not going to be able to afford that when you die. So I'm just going to, get a policy on you. And hopefully these conversations happen before dad is 70, because otherwise you're not going to get it. Or it's going to be really expensive.
Trying to see if there's any other.
I don't see any other questions. I'm cool with wrapping up.
Okay. Well, join us next week once again for our last seminar on insuring your property. And then for those of you who are coming to us, after this session is started, we will be sending out links to all of the different webinars, so you'll have everything at once too, and you can go back and refer to them as you would like. So if you missed the first few webinars, you will be able to watch them at your leisure. Great. See you all next week.